everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMA Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Hello listeners, welcome back. Today we have the pleasure of talking and listening to Dr. Aditya Varma, a well-experienced leading radiologist, on the topic of Aapki Sehat, meaning Your Health program initiated by the Indian Medical Association of Queensland, Australia. Dr. Aditya Varma is a senior radiologist at Pulse Radiology in Rochdale and Logan Lee. Thank you. Welcome, Dr. Aditya Varma, to Aapki Sehat program of the Indian Medical Association of Queensland.
Thank you
Dr.
so
Aditya,
much.
my first question to you is for the viewers' information and listening pleasure. Please tell us about your educational background, professional achievements so far. Thank you.
Hi, Dr. Cyril, thank you for giving me this opportunity to be here on this platform.
Yeah.
And regarding my background, I'm basically from Lucknow, but I have done my education in Belgaum, and then I've moved to Delhi, and then I've done my post-graduation in radiology over there. Just before radiology, I've done a little bit of anesthetics as well, so I have moved around a little bit in pain and radiology and a couple of other subspecialized branches. Thereafter, I did work and get some fellowship training in oncology, and that was at Singapore, and breast radiology at fellowships training at Perth, Charles Gardner Hospital, which was really good. Yeah.
And your family?
Well, in my family, I have a lovely 14-year-old daughter. Very proud of her. My wife is a pediatrician, and we moved to Brisbane just about 5 years ago, approximately.
That's good to know. Yeah. Look, Dr. Aditya Varma, radiology and radio diagnosis, a very important arena in modern medicine, have been over the years, leading towards overall health and well-being of patients, making it easy for diagnosis, helping us, like I'm a GP and other specialists as well. Can you please highlight more on your topic, please?
Well,
conditions, what conditions you do, what you treat,
well, as a branch of diagnosis, helping all the physicians and doctors and specialists around us, radiology now is one of the most important branches for diagnosing, early diagnosis, detection, prevention, intervention, pain management, breast imaging. So it has got a very, very wide foothold now. We do a lot of things in terms of detections and biopsies and giving the results when.
What procedures do you do, in the radiologist center?
So we do injections to the joints. We do all the pain management procedures like facet joint injections, nerve root, injections for headache like occipital injections, and for all the arthritis. We do biopsies for diagnosis like thyroid nodule biopsies, breast biopsies for detection of cancer, grading of cancer, and so on and so forth. In terms of imaging, it is for staging of various diseases and cancer, so it makes it very interesting overall, and I think it's only going to be strengthened by the latest technology, the AI coming into the sphere of radiology, because radiology is a very software and a very technical, branch in terms of requiring a lot of gadgets, and that's the fun of it. But at the end of it, I would say radiology as such, for most of us, it is an image, but how do we move forward to assess that image, because every image is a patient. So that is very important. Every image tells a story.
Yeah, the advancements in the field of radiology, radiodiagnosis, the digital world has made us all like skilled technocrats and helped a lot of us doctors in diagnosing many different disease processes, even early diagnosis. And thank you for updating on this topic, Dr. Aditya. See, most radiologists tend to have a special interest towards certain branches. So what is your special area? You said that you're also an anesthetist background. So what is your special area?
I have done. Having an anesthesia background has really helped me in doing pain management, and I do like because it does give straight good gratification to my patients. I can alleviate them of acute pain, first osteoarthritis. We do injections like HCLA, like the steroid injections, but we've also come up by doing, injections of, say, hyaluronic acid, which is called like Synvisc or Euflexa, or be it one of those sorts of drugs that give a cushioning effect. People who are on long waiting list for knee replacements, they can get those sorts of injection for pain relief. It's not only the part of the injection, we also play a big role in diagnosing and then doing test injections. So there could be backache, and sometimes the clinicians wouldn't know if it is coming from the facet or a joint in the back. Is it actually compromising a nerve root? So we give those test trial injections and help all our colleagues diagnose chronic and acute pain issues, aspirate ganglions, tenosynovitis injections, bursa. So all those sort of things which can be limiting in day-to-day work process. So we try to not only diagnose but also treat some of those things. So that's what I do in terms of pain, and I take a lot back from my anesthesia training from those days. Thereafter, I have done a fair amount of work in onco-radiology at the Singapore Cancer Center, which made me feel that there is always, in our society these days, the cancer the intensity and the numbers are increasing so much that somebody is scared of something, it's getting a sort of malignancy.
Which means radiology plays an important role.
Yeah, so early detection, we work very hand in hand with our physicians, and in early diagnosis of preclinical disease, the outcomes can be really good.
That's good to know.
Yeah.
Look, a lot of these things are Medicare rebated, and we know your radiology center does a lot of bulk billing.
Yeah.
But this program is also aimed at the Indian community people. They have families coming from overseas and students who doesn't have a Medicare card. Is there any help you do for them to reduce the cost? Or
well, if they have everybody who comes in, we do take private cover. Because we bulk bill them, and if they are coming through the right channel, they will be reimbursed. It depends on the cover, obviously. But I hope that they get reimbursed for those. And if there is a very one-off situation where it is an accentuating circumstance, we're always happy to look and hear those stories and see where we can help, especially for the students who are doing the hard yards. We have done it once, and then take it from there and see. And especially even I would say take it forward to their families who are settled here, and then educate them about various other things and spheres.
Yeah, you have covered a lot of areas on radiology. Let me ask you something about your hobbies and activities outside the medical side of things, please, Aditya.
Well, we do like to travel. We do like to, go out for walks. We take out time with family. Traditionally, traditionally we try to go to India 2 times a year, but with the recent pandemic, we haven't been able to travel, so we have been trying to move around in Queensland, and I think it is truly such a beautiful country, Australia, and we feel very blessed to be in this part of the world that is that gives us the opportunity to be so much outdoors, the perfect weather, and it's go for walks or go on a little cruise, or sometimes we on a weekly basis we do have to take care of our health because we spend a lot of time sitting, working.
So relevant to that, what final message do you like to give to our listeners on like a good health strategy, lifestyle strategies, tips on a good mental and physical health?
I would say don't ignore anything that is troubling you. It could be mental, physical, so just come in for an early checkup.
So prevention is better.
Prevention is always good, better.
GP,
see your general physician, go
utilize your services.
Yes,
so
yes, they can always come and get things reviewed. Technology is so good that we have a good grip on disease processes very early on these days. For ladies, I would say, because I'm also a breast radiologist, I would say screening breast imaging is one of the most important things to pick up early breast cancer. It is most of the breast cancer is well treated. I see a lot of patients who are on therapy and who have done so well. They should not be scared of coming out and getting their screening, and picking it up early is always worth in its gold, because you're basically preventing yourself from your quality of life being deteriorated because of late.
Thank you. That is a lot of aspects of radiology covered in a short time. Thank you so much, Dr. Aditya Varma. On behalf of the Indian Medical Association of Queensland, I take this opportunity to extend my extreme happiness and thankfulness to you.
Thank you so much. It was lovely talking to you. I feel very thankful about it. Thank you. Yeah, thanks.
So, ladies and gentlemen, that has been the September episode of Aapki Sehat, meaning your health, with Indian Medical Association of Queensland, hosted by Dr. Cyril Fernandez, and of course the special guest in this episode was Dr. Aditya Varma. Well, until the next episode, it's goodbye from us.